Have you ever opened a medical bill and felt your heart sink? The number was so high you had no idea how you'd pay it. If you're over 65, chances are you've either lived that moment yourself or you know someone who has. But here's the important news. In 2025, Medicare has changed. Some updates could save you thousands of dollars. Others could quietly raise your costs if you don't pay attention. In this video, we'll walk through 6 major areas: the brand new $2,000 prescription drug cap, rising premiums and deductibles, expanded mental health coverage, telehealth at home, caregiver support, and tips for choosing the right plan. By the end, you'll have the knowledge to make smart decisions, protect your health, and protect your wallet. I remember speaking with Helen, a 72-year-old widow from Ohio. Last year, she spent more than $6,000 just on diabetes and heart medications. She told me, "I worked my whole life, and now in retirement, the biggest fear I carry is whether I can afford my medicine." But then her eyes lit up when she learned about the 2025 change. If my out-of-pocket costs are capped at $2,000, I'll finally be able to breathe easier. Helen's story is not unusual. Across America, millions of seniors face the heartbreaking choice between buying groceries, paying the electric bill, or filling their prescriptions. That's why Medicare's new updates aren't just numbers or policy changes. They touch something deeper: our daily peace of mind, our security, and the dignity we deserve as we age. Medicare is the backbone of healthcare for older Americans. More than 65 million people rely on it to see their doctors, access hospitals, and afford prescription drugs. And because it affects both your health and your finances, understanding Medicare in 2025 is more important than ever. If you don't know the updates, you could miss out on benefits, spend thousands of dollars unnecessarily, or fail to get the care you need. So in this video, we're going to explore the biggest Medicare changes of 2025 together. I'll share real-life examples, common mistakes to avoid, and evidence from trusted organizations like CMS, the Kaiser Family Foundation, and AARP. Let's begin with the change seniors have been waiting for: the brand new $2,000 annual cap on prescription drugs. In the past, if you had chronic conditions like diabetes, cancer, or heart disease, your prescription costs could swallow up your retirement savings. But starting this year, things look very different. Let's take a closer look at why this cap is being called a historic milestone, and whether it's as good as it sounds. Part 1. Understanding Medicare in 2025, what every senior needs to know. Let's start with the basics. Medicare isn't just another insurance program. It's the foundation of healthcare for more than 65 million Americans over the age of 65. Without it, millions of seniors would simply not be able to afford the medical care they need. But here's the truth many people forget. Medicare is not free. It comes with premiums, deductibles, and rules that change from year to year. 2025 brings some of the most significant changes in recent memory. In 2025, several things stand out. The government, through the Centers for Medicare and Medicaid Services, CMS, announced a brand new $2,000 annual cap on out-of-pocket drug costs under Part D, higher Part B premiums and deductibles, $185 per month and a $257 deductible, expanded mental health coverage, including family therapy and intensive outpatient programs. Telehealth services remain covered at home. These updates matter because they directly affect your wallet, your access to care, and ultimately, your peace of mind. Take James, a 68-year-old retired teacher in Arizona. He has high blood pressure and diabetes. In 2024, his medication bills totaled over $4,500, and every refill made him anxious. In 25, thanks to the $2,000 cap, he knows exactly how much he will spend. No more uncertainty, no more fear. that one new prescription could wipe out his budget. But James also noticed his Medicare Part B premium went up. He now pays $185 each month instead of $174.70. For someone living on a fixed income, that extra $10 or $20 each month adds up. His story shows us both sides of Medicare 2025. Relief in some areas, higher costs in others. The Centers for Medicare and Medicaid Services, CMS, confirmed these numbers in their official 2025 fact sheet. The Kaiser Family Foundation estimates that more than 1.4 million seniors will directly benefit from the drug cost cap. Meanwhile, the AARP warns that rising premiums could take a bigger bite out of Social Security checks. So, when we talk about Medicare changes, we're not talking about theories or rumors. These are government policies already in place, affecting you and me right now. Medicare can be both a safety net and a challenge. Yes, it offers protection, but if you don't stay informed, small changes in premiums, deductibles, or drug coverage can quietly drain your retirement savings. Knowledge is not just power, it's protection. So let me ask you, have you ever been surprised by a Medicare bill that was higher than you expected? How did it make you feel? Go ahead and share your experience in the comments, because chances are someone else has gone through the exact same thing. Now that we've built a clear picture of what Medicare looks like in 2025, let's dive into the change that has everyone talking. The brand new $2,000 cap on prescription drugs. Is it truly the relief seniors have been waiting for? Or is there a hidden catch? Let's find out in Part 2. Part 2, the $2,000 cap on prescription drugs. Relief or hidden trap? Imagine this. You're at the pharmacy counter and the clerk tells you your total is $600 for 1 month of medication. Your hands tremble. You wonder, how can I keep paying this every month? For millions of seniors, this is not imagination. It's everyday reality. In 2025, Medicare introduced something historic, a hard cap on out-of-pocket drug costs. No matter what prescriptions you take, you'll never pay more than $2,000 a year under Part D. After that, Medicare picks up the rest. For someone with cancer, rheumatoid arthritis, or advanced diabetes, this isn't just policy, it's life-changing relief. In the past, some patients paid $8,000, $10,000, even $15,000 a year just to stay alive. Now, there's a ceiling. Let's take Maria, a 70-year-old grandmother in Texas. She spends $900 each month on medication for multiple sclerosis. That's nearly $11,000 a year. In 2025, she'll pay no more than $2,000. So that means she keeps $9,000 in her pocket, enough to cover groceries, utilities, or even helping her grandson with college tuition. Maria told me, "This change gives me hope. I can finally afford both my medicine and my life." But here's where we need to pause. While the $2,000 cap is a blessing, it doesn't mean medications are suddenly cheap. You still need to pick the right Part D or Advantage plan. If your drugs aren't on your plan's formulary, you could face denials. Not every senior realizes they can opt into the new prescription payment plan, which allows you to spread costs monthly instead of paying all at once. Without it, you could still get hit with large bills early in the year. And premiums for Part D may rise as insurance companies adjust to the new cap. The Kaiser Family Foundation estimates that over 1.4 million seniors will directly benefit from the new drug cap in 2025. Meanwhile, AARP warns that premiums might creep higher as insurance providers balance the costs. This is why staying informed matters. Celebrate the relief, but don't get careless. Medicare's cap can protect you, but only if you choose your plan wisely and understand how the new rules work. It's not automatic magic. It's a tool you need to use. So let me ask you, If your annual drug bill suddenly dropped from $8,000 to just $2,000, what would you do with the extra money? Would you travel, save it, or simply breathe easier? Share it in the comments. Your story might inspire someone else. Now that we've uncovered both the relief and the risks of the new drug cap, let's talk about another big change every senior will feel: rising premiums and deductibles. Because while Medicare is giving with one hand, it's also taking a little more with the other. That's part 3. Part 3. Premiums and deductibles are rising. How to protect your wallet. Here's the part nobody likes to hear. While Medicare is giving seniors relief on drug costs, it's also raising premiums and deductibles in 2025. For many, that means your monthly bills just got heavier. In 2025, Medicare Part B, which covers doctor visits, outpatient care, and preventive services, now costs $185 per month, up from $174.70 last year. The annual deductible also increased from $240 to $257. And if you don't qualify for premium-free Part A, your hospital insurance could cost as much as $500 per month. These are not small numbers, especially for retirees on a fixed income. Consider Robert and Linda, a retired couple in Florida living on a combined Social Security income of about $3,000 a month. Last year, they paid roughly $350 together for their Part B premiums. In 25, that bill is closer to $370. An extra $20 may not sound like much, but stretched over a year, it's nearly $250, enough to cover a month's worth of groceries. Robert said, "Every dollar counts when you're retired. It's not just the premiums. It's also food, gas, and electricity going up." Their story reminds us that even small increases add pressure on a fixed budget. The Centers for Medicare and Medicaid Services, CMS, confirmed these numbers in its 2025 announcement. Meanwhile, the AARP has raised concerns that healthcare costs are growing faster than Social Security's annual cost of living adjustment, COLA. In fact, a 2024 AARP report found that the average retiree spends nearly 25% of their income on healthcare alone. The takeaway is clear. You can't control whether premiums rise, but you can control how prepared you are. Compare your Medicare Advantage or Supplement plans each year. Some plans may offer lower premiums or extra benefits that reduce your total out-of-pocket costs. The biggest mistake seniors make is sticking with the same plan year after year without checking if there's a better option. Have you ever compared your Medicare plan with another and realized you could have saved money? Or maybe you found out too late. Share your story in the comments. It could help someone else avoid the same mistake. Now that we've looked at the rising costs, let's balance the picture with a more hopeful change. For 22, Medicare is expanding coverage for something many seniors need, but rarely talk about: mental health. And the best part? You don't even need to leave home to access it. That's Part 4. Part 4. Mental health and telehealth expansion. Care without leaving home. Let me ask you a question. When was the last time you had someone really listen to how you were feeling? Not your blood pressure, not your cholesterol, but you. For many seniors, mental health is the silent struggle. Loneliness, grief, anxiety. These don't show up on X-rays, but they weigh heavily on daily life. In 2025, Medicare is finally expanding mental health coverage in a big way. It now covers family therapy sessions, so loved ones can be part of the healing. It pays for intensive outpatient programs, helping seniors get structured care without being hospitalized. And the best part? Telehealth services remain covered right from your home. That means whether you're in a big city or a small rural town, you can talk to a licensed therapist without leaving your living room. Take Mr. Johnson, a 74-year-old widower in Ohio. After his wife passed away, he fell into deep depression. Driving 2 hours to see a counselor wasn't possible for him. But through Medicare's telehealth benefit, he now has weekly video calls with a therapist. He told me, "I may be alone in this house, but I don't feel alone anymore." That's the power of these changes. The National Institute of Mental Health, NIMH, reports that nearly 20% of adults over 65 experience some form of mental health concern, yet most never seek treatment. Medicare's new coverage is designed to close this gap. In fact, CMS noted that over 30 million telehealth visits were billed by Medicare in 2020, many for mental health. That number is only expected to rise in 2025. Mental health is health. If you're struggling with sadness, anxiety, or loneliness, Medicare now makes it easier and more affordable to get help. Don't think of it as weakness. Think of it as strength to take care of yourself. Have you ever tried telehealth before? Was it easier or harder than seeing your doctor in person? Share your thoughts in the comments. Your experience could encourage someone else to give it a try. So far, we've seen Medicare cap drug costs, raise premiums, and expand mental health care. But there's another piece of the puzzle that often goes unnoticed: the family members and caregivers who support seniors every single day. Medicare is finally beginning to recognize them too. That's Part 5. Part 5. Supporting caregivers. Why Medicare finally recognizes their role. Behind every senior receiving care, there's often an invisible hero, a daughter who helps her mother bathe, a husband who wakes up at 3 a.m. to check if his wife is safe, a neighbor who drives an older friend to doctor's appointments. These caregivers rarely get recognition, until now. In 2025, Medicare is beginning to acknowledge what families have always known: caregivers are essential. Medicare is launching pilot programs to provide caregiver training, especially for families supporting loved ones with Alzheimer's or dementia. Some programs even offer financial support or respite care, giving family members a break. The goal is simple. When caregivers are supported, seniors receive better care too. Let's look at Sarah, a 52-year-old woman in California caring for her 80-year-old mother with Alzheimer's. Sarah had to quit her job because she didn't know how to juggle caregiving with full-time work. She told me, "I love my mom, but I was burning out. I didn't have the training or support I needed." Now, with Medicare's Caregiver Support Pilot, Sarah has access to online training, counseling, and occasional respite services. She says, "For the first time, I feel like someone is taking care of me too." The Alzheimer's Association reports that over 11 million Americans provide unpaid care for loved ones with dementia. Many spend 20-40 hours a week, essentially a second full-time job, without training or pay. Medicare's new programs are a small but important step in addressing this crisis. Research from the National Institutes of Health, NIH, shows that when caregivers receive proper training and support, hospitalizations for seniors drop significantly. Caregiving is not just love, it's labor, and labor deserves support. Medicare's recognition of caregivers sends a message that no one should carry this burden alone. Do you know someone who is a caregiver, maybe a family member, a friend, or even yourself? What's the hardest part about being in that role? Share your thoughts in the comments, because your story might give strength to someone else. We've talked about drug costs, premiums, mental health, and now caregivers. But there's one final piece we can't ignore: choosing the right Medicare plan. Because even with all these changes, picking the wrong plan can cost you thousands. That's Part 6. Part 6. Choosing the right plan in 2025. Avoiding costly mistakes. Here's the truth. Medicare gives you choices, and choices can be overwhelming. Every fall, millions of seniors get that thick Medicare You handbook in the mail, and most toss it aside because it feels too complicated. But choosing the wrong plan can cost you thousands of dollars. In 2025, seniors still have two main paths: Original Medicare, which includes Part A and Part B, and allows you to add Part D for drugs and Medigap for extra coverage. Medicare Advantage, Part C, which bundles everything together and often adds perks like vision or dental, but comes with a network of doctors you must stick to. The challenge? If you don't compare plans carefully, you could end up paying more, losing access to your doctor, or facing surprise bills. Meet John and Mary, a retired couple in New York. They loved their longtime family doctor. Last year, they switched to a Medicare Advantage plan because it had lower premiums. But here's the catch. Their doctor wasn't in the plan's network. After 20 years, they had to change physicians, and their prescription costs also went up. John told me, "We thought we were saving money, but it ended up costing us more, not just in dollars, but in trust and comfort." The Government Accountability Office, GAO, found that nearly 29% of seniors regret their Medicare choice within the first year, usually because of network restrictions or drug coverage gaps. Meanwhile, the Kaiser Family Foundation recommends seniors use the official Medicare Plan Finder tool each year during open enrollment. Why? Because plans change every year, and what worked last year may not be your best option this year. Medicare isn't set it and forget it. Every fall during open enrollment, take the time to review your options. Check if your doctors are still in network, and make sure your medications are fully covered. A little homework could save you thousands. So let me ask you, have you ever stayed in the same plan for years without checking if there was something better? What stopped you from switching? Share your answer in the comments, because you might inspire someone else to take a closer look this year. We've now walked through the 6 biggest Medicare changes in 2025, from drug caps, rising premiums, expanded mental health care, caregiver support, and choosing the right plan. In the final part of this video, let's bring it all together and talk about what these changes really mean for your health, your finances, and your peace of mind. So let's take a moment to wrap this up. In 2025, Medicare has brought big changes. A $2,000 cap on prescription drug costs, giving millions of seniors financial relief. Higher premiums and deductibles that remind us to budget carefully. Expanded mental health and telehealth services so you can get care from the comfort of home. Support for caregivers finally recognizing the invisible heroes in every family. And the importance of choosing the right plan, because the wrong choice can cost you more than you think. Remember this, small changes in how you manage your health coverage can make a big difference in your life. Staying informed isn't just about saving money. It's about protecting your health, your independence, and your peace of mind. Now I'd love to hear from you. Which of these changes will affect you the most in 25? Have you had experiences, good or bad, with Medicare plans? Share your story in the comments because your insight might help another senior watching this right now. If this video was helpful, please give it a like, subscribe to the channel, and share it with someone you care about. Together, we can make sure no senior feels lost in the maze of Medicare. Take care of yourself, stay strong, and remember, every age can be a healthy, happy age. Here's to living well in 2025 and beyond. This video is for informational purposes only. It is not medical advice, diagnosis, or treatment. Please consult your doctor or healthcare provider for guidance about your personal health or Medicare coverage.